Well, hi, I'm Sharon from Banko Chiropractic, and I'm just letting you know how Dr. Banko felt, a couple months ago, 3 to 4 or 5 months ago. He was saying he was ready to give up practicing, give up working. It was too much for him. His back hurt, his hands hurt, shoulder, and then after laying on the pad, using the probe on his hands, he's back to his old self. He's no complaints of back pain. His hands feel great, and that's all I can tell you.
Was that the QRS or the MRS?
It was the QRS.
And did he try the MRS2000?
Yes, he did.
And
but we got
what kind of effect did he have from the MRS?
Well, we got better results from the QRS.
The QRS, he definitely
QRS,
felt a much better result.
Oh, tremendous, better results. He'd lay on the pad, but he also used the probe on his back, specific areas, pinpoint his carpal tunnel on his hands. So,
I'm Dr. Banko. You just heard from my wife concerning my back complaints. And it happened about 4 months ago. I was doing some yard work outside, and I'm a regular user of the QRS. But I ran into some problems with my lower back, and I literally told my wife that I was about ready to sell the office after 33 years. Excuse me. It was pretty much I had it. But I have a QRS next to my bed, and woke up at 1:30 in the morning and said, I got to try something. So I turned it on full, used it for 8 minutes, and began doing that in this specific location, my right lower back. And I've had problems over the years with this area. And within 2 weeks, week to 2 weeks, I couldn't believe the difference that I felt. And now I'm also an assistant coach at Lehigh University golf team. And there was a time I was having trouble playing and even practicing. I can now practice for 3-4 hours at a time and go play golf, and it's still no back problem. Bending over patients used to be very, very difficult. No back pain. This is what I can tell you about the QRS. This is how well I feel, and it's re-energized me to practice again. And that's exactly what we're doing.
Great. And any comments on using MRS yourself, or just on patients?
Yes, I've been using both machines for approximately 4 years. I have both machines in the office, the MRS and the QRS. I see a lot of athletes. We use both on both of them, but it just seems as though the athletes that I see, the elite athletes, the QRS does seem to be the best one. They come in and that's the one they want to use, even though I have both of them here. The only time they use the MRS is when the QRS is occupied.
Yeah. Thank you.
The ocular pressure in people's eyes that have gone down. We just had a guy with a dermatological condition that the doctors wanted to prescribe all sorts of medication for him, and 2 weeks of laying on the QRS, completely gone. Our MS patient that did so well.
Yeah, that's big.
Yeah. I just can't think of, there's so many, that people have gotten results. And all the athletic injuries as well, so
right.
It's really good.
I just wanted to finish one thing. The point I wanted to make is the reason I bought this is because I started to do anti-aging medicine, and this is one of the topics I chose. And after reading about it, I decided I wanted one. So I talked to Dr. Carmichael out in Colorado, and he was kind enough to send me one just to use.
An MRS?
Yes.
MRS2000.
So I had it, and it was quite shocking of how well after 2 weeks I felt getting out of bed instead of being bent over and hurting anywhere. So I then went and got the QRS, and I had both of them, and brought one to the office, which was the QRS, and then brought the MRS later because we just use it so much. But it's just amazing at 62 years of age how I get up in the morning and I feel nothing anywhere. Right. And my friends who I golf with, same age, they're just half crippled. It's just incredible.
Oh, yeah.